I got started being an audiologist when I went to undergrad at UNC in Greeley. I was interested in speech-language pathology, and I took speech-language pathology classes, and by my senior year of college, I had to take an audiology class. And when I took the audiology class...
In your senior?
Yeah, my senior year of undergrad, I realized that I loved the audiology class, and I liked it more than speech-language pathology. Because I felt like it was a little more black and white than speech-language pathology was.
Yeah.
And so I decided at that point that I would go on to grad school so that I could get my degree as an audiologist.
And how would you describe what you do as an audiology?
I would describe my job as all-encompassing, so meaning I see different ages and I treat different kinds of hearing loss, and I do different kinds of testing to determine what is going on with a patient.
Yeah.
So I see patients who are babies, so birth to 21 years of age, maybe a little bit older if we need to.
Yeah.
And then I do hearing tests. And then from that we can determine if a patient needs to see a medical doctor, so an ear, nose, and throat doctor, or if we need to talk about amplification, so hearing aids.
Yeah.
And then if we do need to talk about hearing aids, then we talk about what that process involves with the parents and then with the patient, so the child. And then we actually go ahead and fit the hearing aid at a later date. And then I continue to follow that patient maybe every 3 months, up to 6 months, then annually up through the age of 21.
Yeah.
And at that point, then we encourage patients to go see an audiologist who works with adults.
And they don't have a hard time trying to wear hearing aids when they know that they have a hearing loss?
Younger kids have a harder time wearing hearing aids because they want to pull them off of their head.
Yeah.
And because it's something foreign on their head that they're not used to. Older kids, I would say, have a hard time wearing hearing aids because it gets to be where they get self-conscious, so that they have something different than their classmates and their friends around them. And so at that point, it's trying to work with them and help them understand the importance and, the importance of wearing hearing aids, like doing better in school, being able to have normal speech and language, working through that with little ones and older patients.
Yeah. And how long did it take to get your career?
I graduated high school, and then I went to undergraduate college, UNC in Greeley, for 4 years. And then I continued on and went to audiology graduate school there for another 4 years. So no matter where you go in the nation, you'll have to have an undergraduate degree to be an audiologist.
And 4 years.
And then 4 years of a graduate degree.
And can I ask about your salary?
I would say that my salary is very competitive for working in a hospital setting. And there are different settings to work as an audiologist. You can work in a private practice setting. You can work in a private practice setting with an ear, nose, and throat doctor. You can work at the VA. You can work for the military. You can work for a manufacturer of testing equipment, manufacturer of hearing aid devices. And so across all of those, I would say that some of those make definitely more money than I do. But my salary in a clinic setting in a hospital is great and competitive for what it is.
Yeah.
And it also depends on where you work. So if you were to work in, let's say, Boston, then my salary would probably be more. However, the cost of living there is more.
Yeah.
So with where I work here and where I live here, it definitely is competitive.
Like in private clinics, you get paid better, don't you?
In private clinics, they usually do get paid more because they have a salary, and then they also usually have some extra money that comes from selling hearing aids.
Yeah.
So they get a portion of that as well. And so that's usually why people in private practice make more money than those of us in a hospital. In a hospital setting, we don't get any money from a hearing aid that we sell. So I may sell like 20 hearing aids in a month or dispense them to patients, but I don't get any of the cut. Whereas if I worked in a private practice, I might get 40% of all of those hearing aid sales.
Really?
Yeah.
And do you work alone or with a group of people?
I do both.
Both.
I do. There are days where I'm seeing patients by myself, and usually that's older kids, from about, I'd say, 3 to 21. And then there are days where we work with 2 audiologists together, and on those days we're seeing kids who are 3 and under, because we get a lot of better testing when we have 2 audiologists.
Oh.
And then I also work in a team setting where I work with an ear, nose, and throat doctor in their clinic. So I do both.
That's good. And are you happy with your job?
I am. Every day is different, and every day is fun. I love working with kids.
How stressful is it for you?
I would say that every day is different. So there are the days that are pretty stressful, and that just depends on the patients that you're seeing. And then there are some other days that are pretty light days and not as stressful. And I would say that the days that are the most stressful are the days where there's a tricky kind of hearing loss, or I have to tell a family or a patient that they have hearing loss. Even, the days where I have to tell a new mom that her baby has hearing loss are probably the most challenging and the most stressful.
So what advice would you offer someone who wants to be an audiology like you?
What I would offer to you, if you're interested, is that it is a great profession and it has a lot of growth. There are a lot of people in the country who have hearing loss, and it's from aging. Everybody gets hearing loss as they age. And then we're now identifying more children with hearing loss because we screen as babies. So I would say, number one, it's a great profession because there's a lot of room to grow and we need audiologists. So it might be an easier job to get than some other professions. And then 2, I would say that you have to know that you have a lot of school ahead of you. So you have an undergraduate degree that you need to get, and then you have a doctorate degree that you know that you need to get.
And do you think that was hard for you?
It wasn't for me because I enjoy school. I mean, there's parts that are definitely challenging for undergraduate and graduate. And to think of 8 years of your life going to school can be a little bit stressful. But the end result is great. You get a great job and a career that you know that you're helping people, helping them live a happier life.
Yeah, that's good. And what is the most challenging about what you do?
The most challenging, I would say, when I have a hearing loss that is not very typical, say, a hearing loss in a sort of syndrome that we see really rare. Those are the most challenging cases because it's something brand new, and so I have to do a lot of research and work with other professionals to determine kind of the best course of action for that patient.
Yeah. So what educational skills are needed to do this? Just the 4-year in college
and then the 4-year of a graduate degree.
So that's 8 years.
8 years. Yeah, and then obviously you'll need to have a high school degree also to get to college. And then I'm glad you asked that, once you get in the profession, you have to stay licensed in the state that you practice. And so you pay the state a license fee. Some states require you to continue to get education. Some states don't. In Colorado, we don't require education. However, we do require certifications, and so to maintain your certification, you have to continue to get education. So what that means is going to conferences, going to seminars and continuing to learn about new hearing aids, about developments and research in the
No, you
field.
don't have to do that.
I do have to do that.
Yeah.
Yeah. I just went to a conference last week.
Oh, yeah.
So it definitely takes time out of your personal life to continue to maintain your profession.
And are you happy in this place?
I am.
Yeah.
Mm-hmm.
How long have you been here for?
I have been here for 3.5 years.
Just 3.5 years.
Mm-hmm.
You moved from the other hospital, right?
I was at another hospital for a year, and